Well, good afternoon, Dr. Vequist. How are you today?
I'm doing amazing. Thank you very much for asking.
Fantastic. Well, we have an interesting topic today that is definitely going to impact everyone involved in healthcare, and that is the importance of trust as it is perceived in healthcare on every side, really. But most specifically, of course, I think what interests you most is how the end consumer researches what can craft and form trust. And of course, from my end, that is something I am always very, very passionate about is to tell healthcare professionals you got to find a way to go beyond the stale generic messaging online and do something that is authentic to the degree that it allows to establish a human relationship to the extent that that is possible through social media, so that there can be this trust factor that down the road will lead to the person becoming a patient. And
Yeah.
what physicians are always worried about is, well, I don't want to talk about clinical aspects because I don't want to give advice. It's something that I can't even do, I shouldn't do. And I agree 100% with them, but there is a way to establish trust in different avenues, in different with different methodologies, using human psychology and creating content around that. But that is what I'm an expert in. We're gonna go to how what everything you know about trust in medical research online. Let's get us started.
Well, as we were sharing earlier, trust in a lot of institutions has been declining, particularly recently. We've seen major decreases in trust in a variety of institutions, including healthcare providers, government, media, and other sources. I think we have a graphic for that.
Yeah, let's look at that. That is a very interesting one.
It's fascinating because it's this again a very well published study that shows that again trust tends to be declining, and we think some of the reasons for that is if you look, for example, at the what happened during the pandemic, we had a lot of voices that were shouting or even preaching to us certain types of messaging, but yet they would change those messages sometimes over time. Sometimes we found out that what they were suggesting or recommending, just quite frankly, wasn't based on empirical evidence, and it wasn't best practices even. So it's been difficult to understand who to trust. And we
Mhm.
also have this interesting government and private business, if you will, back and forth. The FDA, as you ask many physicians, the FDA was never intended to be out there giving medical advice to people um, in the streets. It wasn't intended to be able to shout out messages to people and say, do this or do that. It was intended to collect data and evidence and information and then give advice to trained professionals such as physicians so that they could then work with people and know their particular situation. So it's has not been a good time for trust, particularly since the even before the pandemic began, but then afterwards, and then we have this added, just really fascinating aspect of these large technology companies, which increasingly control a lot of the data and information and voices that we hear, and then we hear about very well thought of and credentialed and experienced physicians and surgeons that are getting silenced on particular issues through either Facebook or Twitter or Google, and it's not a good time to believe that everybody has your best interest in mind.
Mhm.
So, from my area of research, and I just sent you an article about this, we've found that in medical tourism specifically, that there has been several studies, this one from 2015, as I recall, that shows that over 70% of people making healthcare decisions tend to make those healthcare decisions using information from the internet. And as we discussed on a previous webinar, we had talked about the fact that the internet is not a perfect media when it comes to healthcare information.
Mhm.
Most large scale studies have shown that it's about a third of the information on the internet is perhaps incorrect, and about a third of the information is not timely. In other words, it's not up to date with current evidence based medicine. So, therefore, these decisions that are being made are not necessarily completely accurate if you're using the internet as your only source. So, and people say, well, what's the answer? And the answer, I think, is, as you pointed out, to find people that are willing to be as transparent as possible with you. They're going to give you the latest and greatest information. So, obviously, the timestamp or the most recent information is probably going to be a little bit better. And then information from experts in the field that are
Mhm.
actually doing the work,
Mhm.
working in the areas. So I know you've had some great success working with a physician, a DPC doctor, who was talking about specific treatments, and that's really had a good impact on a lot of people.
Yeah. Yeah, that's really a perfect example for what you are describing, because that particular doctor chose to expose information about treatment for COVID with ivermectin, and it was released on his YouTube channel. And it was backed by a scientific professional protocol how to use that, and people were just very grateful for someone to speak about an alternative, because in America, you would think and you would hope that is primarily the case. It's about having options and about having access to the information that allows you to make a decision for yourself. And that was what he really made possible by putting that video out there. And you should have seen the success of that video overnight, literally overnight. He got 1,600 subscribers, because, and from all over the world, by the way. He had people from Australia and the UK, every English speaking nation in the world reached out to see if he could help with that treatment, because it is just, again, about having access to non-censored information that is accurate, scientific, and that shows an option, an alternative to what the mainstream officially backed information is, right? And I like what you said about um, it was kind of confusing at the beginning of the pandemic. You didn't really know whom to listen to, because I remember there was messages coming from the president, from his staff, from the White House. Then there was messaging from the state level, the city level, and then there were various organizations that would give you information, and of course the CDC and the FDA. And like, whom should you really listen to at the end of the day? And especially what happens when some of these organizations contradict each other, or what they say literally changes overnight.
Yeah. So the it's been really interesting. And I, by the way, I appreciated one of the words that you used earlier, which is authentic. I think people are looking for authenticity when it comes to this issue of trust in healthcare. People are looking for experience. They're looking for people that have been there and done that. And as you know, a lot of these politicians, particularly at a city, state, county, even federal level, they were trying to, in many ways, play to our base instincts of fear and survival, and it was a very unfortunate situation, not just in the United States but around the world when it came to trust, particularly on the internet. I noticed we had a comment come in that said,
Yeah, it's a very
yeah,
good one. Let's blend
yeah.
that one in.
So when you're looking for information on the internet, how can you know if you can trust the information? Well, as I stated, one of the things that we've found is very important is to look for more recent postings. So it's very important, for example, when you're looking at articles, to look at the date of the article. And also it's very important to look at the source. And then, so for example, if you're looking at particular physicians that are good, and we know this in business schools. I'm a faculty at a business school, and good business schools, particularly good business school faculty, are seen, heard, and known. So if a physician is well thought of within their community, they will also be seen, heard, and known. So, in other words, there'll be various media around them, about that topic, perhaps even,
Mhm.
that will allow you to then kind of understand that there is this reputation that they've built over a number of years in the treatment of a particular area.
Mhm. Yeah, that's a very good point. What I note is, as someone who's on the side of marketing and public relations for healthcare professionals, is that those who truly have who resonate with people and who also get professional results are those who are, as you said, passionate about the cause. They typically truly care about their community, and they have a specific angle to solve a specific problem in the community, and they want to make that known. They're not afraid. Actually, they will overcome their fear and their reluctance to interact with certain technologies to bring out the information. And that is what I truly want to, what I can contribute as someone who is really looking up to healthcare professionals. What I can contribute is, well, first, in the realm of the Free Market Medical Association, promote transparency and access to the marketplace. And then, second, as a professional who helps physicians have information out there, enable them to have a clear, concise platform where they can be there and speak their truth. And there is something about also that I want to mention about, from a very practical business perspective, about being found, is online reviews. There are several platforms out there where your patients can leave you a review. And clearly, if your patients are happy with you, you help them in their healthcare journey, well, then you are in a position to ask for a review, something that is really very impactful if they do that on your Google My Business profile, because that will tremendously increase your local search, which is something that I'm always being asked: how can I be found locally? And then, of course, there's different platforms, aggregators, that the name escapes me now, but it is, what is the platform? Doximity, I believe.
Doximity,
Yeah.
correct. Yeah, Doximity, which basically provides a summary of research, is one of their tools that they provide to physicians. We have actually another comment from Michelle, who's
Yep.
also a nurse. And interestingly, these in nursing and in many healthcare professions, they have these get-togethers that they sometimes call book clubs or journal clubs, where they get together and they look at various different trends in their particular area of healthcare and try to make sure and share the information among the practitioners so that they're all kind of speaking the same language and using the same protocols. And this understanding by professionals, to get to her question,
Mhm.
should be translated from professionals and people that know the research to the lay people. So we kind of have to rely on these expert voices. But again, there's multiple expert voices out there. And by the way, that's the scientific method. So it's okay that there are people that have, for example, new data that have analyzed it in a different way or used a different measurement device, and they're coming up with a slightly different hypothesis in regards to what they're finding, because that allows you to then take these sources of information and take them together, and you have, if you will, competing voices in the room. This is the scientific method, and what we find is that over time the truth prevails in the particularly when you share transparency of data. There has to be transparency in the data, and
Mhm.
then ultimately what happens is there's this shift, if you will, in the way that people think about things, and they come to a agreement in what they believe to be the case, and that may change over time. So
Mhm.
again, what we believe to be true today, 6 months from now, with additional data, additional findings, larger sample sizes, may actually be untrue. But we do rely on experts, and that's part of the problem. Is we have this trust issue with experts. Now, real quickly, we have another question coming, but I wanted to point us back to two other articles which are really fascinating, which
Okay.
is and gets to Michelle's point. How do lay people understand this? Well, one thing we don't want to do is just completely rely on Google and the Google results that come out of Google.
Yeah, that when you told me that, I didn't even know that, and
So
I'm like
we've got
shocked.
two really fascinating issues. This issue that we brought up, which is that Google is actually in the process and has already rolled out some functionality for a separate health engine, a search engine for health,
Mhm.
and the health searches make up seven, perhaps even a little bit more, closer to 10% of total searches on Google, and this is a $1 trillion market. And so Google has some incentives, if you will, to potentially route certain types of searches and to give out certain types of information. To highlight that, and goes to the other article. Sorry, the Google actually has made a commitment to certain types of healthcare
Mhm.
entities they have signed agreements with to basically make sure that searches are prioritized to certain types of providers of information. Now, this may seem like a well-intended effort to make sure that people are getting the information that they need, but you can see how this could be dangerous because you're basically having big tech, and we saw this from Facebook and Twitter and many others that were
Yes.
silencing voices that may have been, for example, alternative views about specific treatments.
Yeah.
That
And big tech is big business, and they when they get at a certain point where they really can't afford to not listen to the public opinion, and especially if you recall when Mark Zuckerberg was called to Congress, to justify certain things he did in his business. I mean, they had to make decisions that I know for a fact they didn't want to make. Like they had to drastically increase privacy features, which I know a lot of people, a lot of the viewers here are in favor of that. But this is just to the point I want to make is that big tech at some point can no longer be completely unbiased and independent. And then, of course, if you recall, there was a platform that was called Parler, which was almost a Twitter alternative. and they got completely annihilated because of public opinion and also political decisions, to where at that point they were literally, the rug was pulled under their feet. They had, the hosting providers wouldn't collaborate anymore, nobody would sell them services. And it's just something that in a country where freedom of speech and access to options, alternative, and good information should be possible, is just something that is dangerous.
Yes, agreed. So the point is, when you're particularly with Google, and I can throw Facebook and Twitter and all the other social media in there, there's no guarantees right now. In fact, we know for a certain that Google is not giving you all the alternatives. They're not giving you access to all the information. They're routing you. These are not organic searches that are without human intervention. These
Mhm.
algorithms have been tweaked, and they are actually um, trying to shape opinions around specific types of behavioral decisions people make around healthcare. And I believe that this is unfortunate and potentially dangerous. Now, people will say there's also a danger to letting people have access to information that may be untrue. I think to some extent, what we have to do is we have to have the balance of this public square where there are going to be some voices that are incorrect, and then we have to allow people to see a lot of this data and a lot of this information and then simply make decisions on their
Mhm.
own.
And that is really a larger societal question, where you have to put an emphasis on the importance of critical thought and education of your
Right.
nation, so that people can make good decisions based on information presented.
Yeah, I wanted to get to Mariana's question too.
Yeah.
She had a very good question coming up. So the idea of these book clubs is a fascinating subject. And by the way, we see, particularly in my area of research, where people are engaging in consumer choice and patient consumerism, see this in medical travel quite a bit. And one of the fastest growing trends in on the internet, and particularly in healthcare on the internet. So you may not realize that it was about a year back or so, Facebook was publicly and also privately worrying about these forum sites that were creeping up. One is called Nextdoor. Some of you may be familiar with it if you live in a neighborhood. They typically have next door neighborhoods.
Mhm.
And what Facebook found was that people over the last few years have been gathering together in communities or groups that have similar interests or values, or in this case in healthcare, disease categories. And so if you look out on Facebook now, and they've been pushing this in their commercials for over a year, maybe 2 years now, is these communities or groups. And we find that there's all sorts of healthcare groups. So if it's around breast cancer, prostate cancer, you name it. So I just was on a podcast that's for the ALS community, a terrible disease for all those that suffer it. And so, what we find on these community groups, these communities of interest, as it used to be called, is that they bring together some of the best information and data and the newest studies, and they bring experts into these forums, and they make recommendations about. This is truly crowdsourcing at its
Mhm.
very best, and
Mhm.
this is what the internet was intended to be, in my
Mhm.
belief,
Mhm.
around healthcare. So this is, if you will, a layperson version of these book clubs. These book
Yeah.
clubs, journal clubs, as they exist in healthcare, are meant to be where experienced professionals get together and share these best practices, the new protocols. They share evidence-based medicine that comes out of the research, because the amount of research that comes out in the healthcare sector is just it's too much. There's so much out there, and so that's why these technology tools have developed, like Doximity, to filter this down, or at least to consolidate or summarize it for providers.
Mhm.
But these book clubs for lay people, and this gets back to a little bit to what Michelle's point was. I have maybe it's just my bias, but I have some trust in these groups because, again, people that are suffering from a disease, people that have parents, children suffering from a disease that are out on these forums, they're passionately, intimately involved in this.
Yep.
And they're looking for something that Chang brought up earlier, which I think was very important, which is they're looking for something authentic,
Yeah.
and they search vigorously and passionately for
Mm.
this.
And
So,
yeah, if you would allow, Dr. Vickers, the this is so great that this topic is coming up because I'm often being asked by physicians, well, what can I do online? And you can literally, if you lead or head or organize or co-author a community like the one you referenced, that can be amazing for you to contribute to the community, to your cause, and to build up that trust. And I want to bring up an example that a doctor that is a friend of mine, Dr. Gernida here. Uh, Dr. Gernida is a rheumatologist, and she created her business page is Rheumatologist on Call, and the group is sponsored by it. And then she created this group, Autoimmune and Arthritis Support Group. And as you can see, it has 8,000 members. And this group, I believe, now has been in existence for about 4 months. And within those 4 months, 8,000 people joined, and she is constantly curating because when you have a lot of people coming together, there's a lot of opinions and a lot of information. And as a healthcare professional who takes time to go and curate and fact check, if you will, from a scientific perspective, whether what's going on in such a forum is correct or not, that is definitely something that creates trust and is authentic, and people really value that. So
yeah,
that's definitely for physicians who are watching us. You just saw this works, and you have that wealth of knowledge, and you've chosen your profession because you want to help, and this is one way. This is just one of many ways.
yeah. So we also have a question from Andrea.
Yep.
Just wanted to get to that. So, how can trust be restored in the public? Oh, that's a. I'm sorry. I wish I was smarter, and I wish I knew the answer to this. I think it goes a little back to Michelle's point about this evidence-based practices and interpreting these findings. I think we need to have, my humble belief, again, we need to have more voices in the room. So we need to have all the voices in the room, and we need to have the ability, more transparency. So we need to have the ability to go and see who these voices are, their background, have had other sources picked up on this person and said, this person has routinely brought evidence to us in the past. Um, and so if you're in media more often, and you've published things more often, that's probably a way to judge a person's potential future predictions about what they think is going on. So, but trust, we need to have the ability for people to choose among experts, the experts that seem to have the best background, the message that speaks to them is authentic, and then they need to perhaps get an alternative. I think in one of the previous episodes we had
Yeah.
talked about the second opinions,
Second opinion. Yeah.
the last one we did. And that's I'm such a big fan of second opinions and the second opinion industry, which is growing up within the healthcare community. It's being used by companies like Walmart. They're finding about 25% rate of overriding using an expert opinion compared to a primary care physician that may not have as much experience in that area, and the specialists are typically overriding it about 25% of the time. It's high, but that's more voices in the room. That's not a bad thing. This is a good thing. And so let's use the internet for what it was supposed to be intended for. And by the internet, I mean Google, I mean Facebook, I mean Twitter, to have multiple voices out there, to have these. And I'd really put a call out to physicians, people like Michelle that asked us a question earlier. Share your expertise with people, grow your career by contributing summaries of again evidence-based research that's out there, and make a contribution to people in healthcare by truly turning the internet, or at least the healthcare portion of the internet, into a place where people have so much information that they can truly get into this and read this and learn and grow and develop. I think
Mhm.
that's the future of healthcare on the internet.
Yeah. So, what are your thoughts around the organizations that sometimes, well, actually, most often are also commercial operations that give a certification to certain to healthcare providers, for example.
Yeah.
Um, what are your thoughts around
No, buyer beware again. Fascinating that you bring this up, by the way. So just this week, if you'll go out to, for example, my LinkedIn page, you'll notice that, and I'm leaving here in a few minutes. I apologize, to go to my meeting for the Journal of Healthcare Management Standards, which is associated with ANSI, which is the American National Standards Institute. It's also tangentially related to my involvement in ISO, or the International Standards Organization, where I'm on the American team for ISO 304 tag, which basically comes up with healthcare management standards for the world. And so we use a lot of evidence-based research to come up with these standards.
that?
I just had an article that was just published with a couple of co-authors that looked at these credentialing or accreditation, or these labels that sometimes healthcare providers put on their sites. And this was particularly looking at international hospitals. And what we found is that, quite frankly, most of these labels tend to be signaling strategies. They are signaling their quality to consumers, but there's no guarantee that that signaling actually will lead to, when it comes to, for example, a healthcare provider or a hospital, lead to more patients coming in.
Mhm,
So, real quickly, one of the things that we use in business schools is, we often say, for example, Harvard has a what's called a AA accreditation in business schools, Harvard Business School. But quite frankly, if you had a child and Harvard didn't have a AA accreditation, if you wanted to send them to one of the best business schools on the planet, would you still send them to Harvard Business School? Most people say yes, right?
mhm,
So the point is, even without the accreditation, Harvard Business School would still be considered one of the best business schools on the planet.
mhm,
So we find the same is true in healthcare. These accreditations, these labels and things may be an indication of quality, but there's no guarantee that it necessarily is. Most of the time, quality facilities tend to have these labels, but that's because they come with being a quality
mhm,
organization. So the label itself. Interestingly, also in that article, just like to bring up briefly, most Americans don't realize that the country of Mexico, for almost a decade now, has been using the American healthcare standards to credential
mhm,
their hospitals. So again, most Americans would say, "Wow, a Mexican hospital probably isn't at the same level of quality as American." Well, they're using the same standards now, and have
mhm,
been for quite a while. And there's hundreds of Mexican hospitals and clinics that are actually using the same standard that we use here in the United States, which is the Joint Commission standard.
mhm.
It's fascinating.
Fascinating. Yeah. Well, I know you have a meeting to attend. I want to thank our viewers today for being very engaged. It's certainly much more fun, and we get to get your perspective and see what really matters to you. So, thank you for that. You you can definitely post your questions in the comments even after this live is over. And Dr. Vequist, thank you so much for taking the time, your expertise, and this highly educating conversations that we can have together for any physicians or healthcare and wellness providers out there who would like to have my help to do precisely what we spoke about, which is build up trust online. Please reach out, and would be happy to have a conversation around how that can happen. And we'll be meeting again next week. And I wish everyone a great rest of their day and restful and joyful weekend ahead.
Thank you, Shankar. And thank you, as always, for providing this forum and helping to so many doctors and healthcare providers to increase the trust of the people.
My pleasure. Thank you.
Thank
Bye
you.
bye.